listen to your body and know your body. B, denial does not change anything, you
Nope.
know? And so this phrase, sometimes you hear people say, oh, I'm not going to claim that, you know? That comes like not claiming something isn't necessarily going to change that outcome, you know? And so if it's
Right.
really there and it's in black and white on a piece of paper, that's the diagnosis. It's really there. You know, that's just, you can't argue with that science. You know, I did want to just have speak to the point of, you know, a cancer diagnosis not just does not obviously just affect one individual. A cancer diagnosis affects families and generations. And obviously, the more empowered and more informative you are, Ron, the better you can be a better father and a better protector for your children and for you know anyone else out there. So
Absolutely.
so that's a very important thing. Another thing I just wanted to speak to really briefly is again, you know, I reference this idea of with a cancer diagnosis, there are three types of people that can help you: surgeons, radiation oncologists, medical oncologists. With any cancer diagnosis, definitely reasonable to say, can I hear and talk to each a person who, you know, a medical oncologist, a radiation oncologist, a surgical oncologist, or a particular specific surgeon, just so that you get all the opinions that in terms of how you can get your treatment and management for your condition, you know, and then you can hear about these different treatment modalities. Yes, radiation is very brief, you know, as you talked about, you come in 5 days a week for about 10, 20-minute sessions, you know, and nothing hurts. You know, none of these treatment modalities should hurt you. All of those things like radiation, targeted beam therapy, it's not going throughout your whole body. It's really just hitting the particular prostate bed and that gland and the you know the tissue around it. You know, surgeries happen just in one area. In my field as a medical oncologist, we do use systemic therapies, but again, that's when a problem has already spread to other parts of the body and other organs. So things like chemotherapy, I want to continue to use the phrase immunotherapy and sometimes endocrine or hormone therapy, similar to this, you know, androgen deprivation therapy you're using. These are all treatment modalities that, you know, someone in medical oncology would use to treat a cancer that has, you know, might have spread to other parts of the body. But none of these things should be entities that hurt you, and they should always be described and discussed with enough detail that you feel comfortable receiving any part of it. Okay, so you know, that's really it's, you know, to the person prescribing it to be able to talk about those things and side effects from that. So